You have to have a core of people who have got a common understanding of what we're talking about in terms of self-management support, so that you can have enough of a dose, if you like, a local dose of people who can move forward on influencing and putting things in practice.
To start by learning what it is that is valued by the patients that they work with, and then figuring out how they can use what's in the local communities and also the skills of the local workforce and the health workforce to achieve those aims.
Co-delivery of any programme that you have is essential. It provides a practical example of a model of parity between clinician and patient service user, people living with long-term condition, that is very useful.
Hearing the stories of the difference this makes, both to people living with long-term conditions, absolutely life transforming, and to the people who are working in the system. So this is actually, it makes a difference to people's, clinicians' working lives as well. So it's about capturing those stories and filtering them through the system.
Policymakers understand the need for change. I think they realise that the current healthcare system in its current shape and form is unsustainable. We are creating a huge burden of responsibility in healthcare which we just can't sustain. And that's because of our current sort of compliant, curative model of healthcare.
I think what I'd like to see is that this becomes sort of core business for the hospital, rather than something that's added on to the sort of traditional healthcare model. So it's about refocusing what we're doing and trying to put self-management at the centre of healthcare in our region.
For commissioners, I'd say that they should start by doing a literature review and seeing what's out there in local communities and across the UK and elsewhere in terms of what is a kind of a framework for good self-management, and then test it with their local populations, and not just patients but also with healthcare professionals, with voluntary sector.
We can't just think at the beginning of the year we're going to commission X, Y and Z and expect some of that kind of bottom-up community development sort of work to happen within a year. We need to be thinking longer term. We need to be supporting third sector organisations to have a common understanding of what it means to support self-management.
Traditionally we are there, I know what's right or not good for you. I'm the clinician, I know best. So giving up that kind of thinking is difficult, but that's what's required really, that in actual fact the patient, in particular a person with a long-term condition, knows best.
Listen to your patients during consultations, to use the phrase, is there something else, rather than is there anything else. Anything else tends to imply closure. Something else leaves the conversation open.
Unless you get people who have got the message and understood the vision and its capacity to transform the whole system, it ain't going to happen.
Even though you're thinking about what you're going to do on the computer, turn away from it, because people think that you've switched off from them when you turn away. If you focus your attention on them, it's worth a lot. Is that little bit of attention goes a long, long way.
Recognise what's achievable and what isn't in the sort of time frame that you've got, and making small steps towards a long-term goal. Because I think if you try to do too much at once, it can be quite disheartening.